Three, two, one. We are live now, ma'am.
Good afternoon to all our viewers. Welcome to our Facebook Live program. Today, we will be discussing a highly relevant topic that is bone health in parents and elderly people. We are honored to have Dr. Srisanat Rao with us today. Dr. Rao is Maharashtra's first degree holder in joint replacement, that is, Fellowship in National Board of Arthroplasty. He has completed his MBBS from Government Kilpauk Medical College in Chennai and earned his DNB in orthopedics from Jaslok Hospital in Mumbai, where he has gained extensive experience in trauma, arthroplasty, arthroscopy, pediatric orthopedics, and spine surgery. Dr. Rao further specialized in joint replacement at the renowned Dinanath Mangeshkar Hospital in Pune, where he trained himself in conventional and computer assisted robotic hip and knee replacement surgeries. With over 2,000 surgeries to his credit, Dr. Rao has shared his research at numerous national conferences. He is also the author of Orthopedic Practical Examination Made Easy, a book which is a valuable resource to all orthopedic postgraduate students preparing for the exams. Currently, Dr. Rao is part of Dr. Vikram Shah's team and serves as consultant joint replacement and reconstruction surgeon at Zainova Shalby Hospital in Ghatkupar, Mumbai. We welcome you, Dr. Rao, and we are excited to hear from you about bone health in elderly patients. Over to you, sir.
Thank you. Thank you, Ms. Anjali, for the introduction. Let me just share my screen. Is the screen visible?
Yes, sir.
Yeah. So we are going to be talking about bone health in parents and elderly people. As India is going ahead at a as we are growing at a very rapid rate, unfortunately, right now we've moved on to a place where the young population is slowly converting into a very elderly population at a very rapid rate. Because right now, what people are looking forward is having one child rather than having two, three children, as was the norm earlier. So by 2045, we are expected to have a lot of elderly or more towards the elderly category. And because of that, it is very important that we keep in mind how we can keep ourselves or our parents healthy at that age group beyond 45, 50 years. And that is why this topic is very important, because once you develop a fracture, it is a catastrophe that just keeps rolling over into a bigger phenomenon. So what is this bone health or osteoporosis that we are talking about? Osteo is bone. Now this bone is full of small pores. अब ये जब pores बड़े होना चालू हो जाते हैं, that becomes osteoporosis or a bone that is full of holes. Now why is this important? ये bone जैसे उम्र बढ़ते जाता है, the bone quality that is there between 20 to 30 years is different, and the bone quality that a person at 65, 70 years has is different. It is nothing but osteoporosis is a skeletal disease. It can affect any bone of the body, wherein वहां का अंदर का जो कैल्शियम रहता है वो कम होते जाता है. एंड सिर्फ कैल्शियम नहीं, उसके अलावा जो बोन स्ट्रक्चर रहता है उसको भी फ्रेमवर्क को खराब करता है. So how do you tackle this? So this normal quantity and architecture. If you see, there are a lot of books on top and there is a table over here. In the middle slide, in the middle section, you will see number of books or the calcium quantity has decreased. Also, the framework on which the calcium is deposited, that is also weak. Now, when we come to osteoporosis, the calcium quantity has also decreased and the framework is also broken. So loss of architecture and loss of the bone quality both together is what constitutes osteoporosis. So who ideally gets this disease? Is it just one person, or can anyone get the disease, or is everyone prone to osteoporosis? Certain factors, कोई चीजें रहते हैं जो मॉडिफाइबल मतलब जो आपके हाथ में रहते हैं. देयर आर सर्टेन फैक्टर्स जो आपके हाथ में यू कैन नॉट प्रिवेंट इट, and certain factors which are not preventable or non-modifiable. These include age. Sometimes age of 50, 55, 60 is not under your control. Being born as a female is not under your control. If there is any family history of osteoporosis or you've been born at a low birth weight, again, these are all not causes that factors that are under your control, which can cause osteoporosis later in your life. Now, factors that are under your control: smoking, alcohol consumption, less intake of fruits and vegetables, especially green leafy vegetables, use of corticosteroid, use of steroid therapy in any of your treatment, uh, history of frequent falls. Now, these are some factors that are under your control which can cause osteoporosis. So, osteoporosis in elderly. Now, what is this osteoporosis? As we started earlier, now when you are about 20 years, 25 years, 30 years, the bone keeps remodeling. So, what is this remodeling? Bone breaks down, bone forms again. Bone breaks down, bone forms again. But beyond a certain age in life, about 50, 55, beyond that, bone breakdown occurs, but bone formation cannot match up with the pace of bone breakdown. And because that happens, there is a faster rate of bone breakdown and a slower rate of bone formation. This leads to the framework getting altered on which the calcium deposits. So what are the other risk factors in osteoporosis? Female sex, as we discussed, estrogen can cause osteoporosis. Low levels of reproductive hormones. If there is a family history, osteoporosis, smoking, any physical inactivity, you have no exercise. For any bone to be healthy, you have to walk, you have to exercise. जो impact गिरता है पैर के ऊपर, that can cause a good amount of bone strength. Now, when impact गिरना बंद हो जाता है, either because you have some sort of pain or because you're lazy or any other activity that prevents you from doing that causes inactivity, this can increase your bone weakness or osteoporosis. Long-term use of any sort of medication because of medical issues, nutritional deficiencies like low intake of fruits and vegetables, and Asian people, as Indians, are prone to osteoporosis. So what happens is after menopause, the body estrogen level goes down, and once the body estrogen level goes down, the body has the capacity to form vitamin D3. It causes low production of vitamin D3, the estrogen hormone. So when there is low vitamin D3, what vitamin D3 does is it causes calcium absorption from your stomach. So when there is estrogen decreases, it prevents D3 formation. D3 decreases, it prevents calcium absorption. So because of this, it is a vicious cycle. वो जो कैल्शियम एब्जॉर्प्शन कम होते रहता है, बोन डिपोजिशन के ऊपर भी फर्क पड़ता है. Because of that, there is a significant increase in osteoporosis post-menopause. For women, the menopause starts after 45. For men, you would say osteoporosis starts after 55, 60 years, which is called andropause. So is the disease really so common, osteoporosis? If you are comparing the annual incidence in women, it is noted, literature shows that osteoporotic fractures, because of bone weakness, fractures का chances ज़्यादा बढ़ जाता है. And which fractures? The most commonest fracture is spine fracture. How? Even just doing a halka, this khasi jerk itself can cause a spine fracture. A small slip and you just keep your hands down, that can cause a wrist fracture. A small slip and you hit your hip against a wall or something. Again, hip fracture का chances, खुपे का फ्रैक्चर का चांसेस बहुत ही बढ़ जाता है उसमें. सो इसलिए ऑस्टियोपोरोसिस के ऊपर ध्यान देना इज वेरी इंपॉर्टेंट. तो वर्ल्ड वाइड ऑस्टियोपोरोसिस डिजीज बर्डन देखा तो अबाउट 8.9 मिलियन फ्रैक्चर्स एनुअली हो जाते हैं ऑस्टियोपोरोसिस की वजह से. ऑलमोस्ट रिजल्टिंग एवरी 3 सेकेंड्स में एक ऑस्टियोपोरोटिक फ्रैक्चर होने का चांसेस किसी को दुनिया में रहता है. And 1 in 3 women over 50 years of age will experience an osteoporotic fracture. It is more common in women than men. So according to WHO figures, 1 out of 8 Indian males suffer from osteoporosis, especially after andropause, that is after 55-60 years. वैसे वुमेन को देखा गया है तो 1 out of 3 Indian females suffer from osteoporosis, way less than what is expected in males. So that is the reason why women tend to develop a lot of common fractures, and for this reason we have to be very cautious when we treat our mothers. What are the problems with osteoporosis? As we discussed, bone mass decreases, कैल्शियम डिपॉजिशन कम हो जाता है, जो कैल्शियम जो बोन स्ट्रक्चर के ऊपर डिपॉजिट होता है वो फ्रेमवर्क भी खराब होना चालू हो जाता है. दिस इज ड्यू टू अ डिक्रीज इन ईस्ट्रोजन. सो ऑस्टियोपोरोसिस क्या कॉज करेगा? बिकॉज बोन वीकनेस की वजह से मोस्ट कॉमन इज फ्रैक्चर. सेकेंड मोस्ट कॉमन इज बोन पेन. इफ ऑस्टियोपोरोसिस वेरी सीवियर, फ्रैक्चर लेस सीवियर, बोन पेन. सो ये फ्रैक्चर्स में बहुत कॉमन फ्रैक्चर होता है स्पाइन का, कमर का फ्रैक्चर. कमर का फ्रैक्चर के अलावा नेक्स्ट कॉमन फ्रैक्चर रहता है हिप फ्रैक्चर, दैट इज खुबे का फ्रैक्चर. थर्ड रहता है रिस्ट का फ्रैक्चर. एंड ये स्पाइन का फ्रैक्चर जो रहता है यूजुअली D12L1 लेवल पे हम कॉमनली वो स्पाइन का फ्रैक्चर देखते हैं. एंड ये फ्रैक्चर विदाउट हैविंग एनी मेजर फॉल भी हो सकता है. एंड दैट इन्वॉल्व, जैसे हमने पहले डिस्कस किया था, जस्ट हैविंग अ लिटिल बिट ऑफ अ कॉफ और हैविंग अ जर्क एंड सिट डाउन. सो ये सब कॉजेज रहता है फ्रैक्चर होने का. सो द मेन मॉर्बिडिटी ऑफ ऑस्टियोपोरोसिस इज फ्रैक्चर. 50% of women in the world will suffer from an osteoporotic fracture in their lifetime, which is very scary. So previous fractures are strong. So घर पे किसी का फ्रैक्चर हुआ है पहले, या घर पे एल्डरली मदर्स को ऑस्टियोपोरोसिस कभी डिटेक्ट हुआ है आपका घर पे, so you are a candidate for osteoporosis in the future. So you have to get yourself screened for osteoporosis once you reach a menopause or an andropause. So if you see the fractures that are there, as we grow, about when you reach about 80-85, the most common fracture is the hip fracture. Although the most common fractures in osteoporosis is spine, but as we grow older and once you reach about 85 years of age, hip fracture chances increases very high. Then it is followed by a spine fracture and wrist fracture. So what are these? Why are these very dangerous? Because most of the time for these fractures, especially when you have a hip fracture, the treatment option is usually surgical to help in the pain decreasing. So if you have sustained a fracture and you have an osteoporosis and you decide to have treatment conservatively without any surgery, sometimes the fracture does not unite. हड्डी जुड़ता नहीं है और फ्रैक्चर के बाद जब प्लास्टर वगैरह लगा के रखते हैं तो. रीजन बीइंग ऑलरेडी वहां पर जो हड्डी का फ्रेमवर्क है वो खराब है, कैल्शियम जो है वो बराबर डिपॉजिट नहीं हो रहा है. सो जब हड्डी टूटता है, नया हड्डी बनने के लिए वहां पर इतना ताकत नहीं रहता है. सो फॉर दैट रीजन treating a osteoporotic fracture with just a plaster or bed rest also becomes very difficult, and that is why we usually tend to go towards surgical management, at least to decrease the pain initially. So there is a chance, especially fracture होने के बाद, as we discussed, delayed union. बहुत लंबा, usually for any fracture to unite 3 महीना लगता है minimum. Osteoporotic fracture रहा तो कभी कभी 6 महीना, 9 महीना, 1 साल तक भी लग सकता है for a fracture to unite. डिलेड कैलस फॉर्मेशन, उसका मतलब है कि डिलेड हड्डी जुड़ना जो है आजू बाजू में, जो सॉफ्ट बोन फॉर्म होता है पहले, बिफोर हार्ड बोन फॉर्म होने के पहले फ्रैक्चर के बाद, तो वो बोन बहुत स्लोली फॉर्म होता है, जो सॉफ्ट बोन भी फॉर्म होता है. नॉन यूनियन, कभी कभी हड्डी जुड़ता भी नहीं है बिकॉज ऑफ ऑस्टियोपोरोसिस. सो दिस decreased quality of life, it can also increase the death rate of the patient. So there is 10 to 25% mortality because कभी कभी हड्डी जुड़ता नहीं है, पेशेंट वो हड्डी पेन के वजह से थक के they lose their confidence. वो कॉन्फिडेंस जाने के वजह से some of them are unable to walk independently after a hip fracture, and some of them, because of the loss of confidence, because of depression, because of unable to do their own daily activities, sometimes lose the ability to live independently. There is an increased chance of depression because you're in bed. हड्डी जुड़ने तक बेड पे लेटे रहो, जो यूरिन टॉयलेट वगैरह जो करना पड़ता है वो भी बेड पे करो, because of the bone not forming. All these lead to a high level of chronic pain and disability, especially in the elderly population. And there is an increased risk of further fractures in those population. So if you want to know whether you have osteoporosis, how will you know? It will remain. Initially, you might not have any complaints. पहले there will not be any complaints. You will feel I am very healthy, तो मेरे को कुछ problem नहीं रहता है. And this will remain a problem for many years until one fine day you realize कि नहीं मेरे को बहुत ही कमर दुख रहा है, बहुत ही छोटे मोटे हड्डी जो है हाथ का वो भी दुख रहे हैं, सुबह उठने के टाइम पे पूरा बॉडी दुख रहा है मेरे को. These are all signs of that you have some form of osteoporosis. And sometimes in our elderly patients, कभी कभी लेट तक कुछ सिम्टम नहीं रहता है, especially 65-70 तक. One fine day you will realize कि एक दिन सुबह उठने के टाइम पे you are unable to get up. You have a sudden pain and you are unable to get up. And this is because of the fracture that has occurred because of osteoporosis. So if any of your parents or elderly mothers are listening, if you are having a loss of height and slowly you see that from standing straight, धीरे धीरे आगे झुकना चालू कर देते हैं, that can be an indication कि आपका हड्डी में थोड़ा दबाव आया है या पेन की वजह से आगे झुक के चल रहे हैं. So इसको ध्यान देना is very important. So if आगे झुक के चलते हैं, that is because of either a fracture और हड्डी के ऊपर थोड़ा दबाव देने की वजह से और because of pain. So ये क्या टेस्ट रहता है ऑस्टियोपोरोसिस डिटेक्ट करने के लिए? Basically what we are looking for is a bone mineral density करके बोलते हैं. Now there are multiple tests to detect bone mineral density. उसमें most common is that we use right now is the last one, DEXA या dual energy X-ray absorptiometry करके बोलते हैं. That is a higher form of X-ray. ये एक्सरे मशीन रहता है, उसमें वो क्वांटिफाई करते हैं कि आपको ऑस्टियोपोरोसिस कितना रहता है. अभी देयर आर सर्टेन वैल्यूज -1 to -2.5, -2.5 एंड बिलो. इफ यू आर बिटवीन -1 to -2.5, आपको हम कैटेगराइज करते हैं ऑस्टियोपिनिया करके. ऑस्टियोपिनिया इज लेसर वेरिएंट ऑफ ऑस्टियोपोरोसिस, जिसमें इट इज जस्ट द स्टार्टिंग स्टेजेस. व्हेन यू रीच -2.5 and below value in a DEXA scan, then we will be considering you as an osteoporotic patient. And at that time, it is very important that you get yourself treated if you want to avoid any kind of fracture, even with a minor slip. So this is a machine that we utilize which is the DEXA scan, as we discussed. So what is the treatment? So we have to, the goal is to keep ourselves moving. Mobility is very, very important. We have to increase the bone mass. The bone mass can be increased by two ways. The first way is diet. The second way is exercise. There is one more way. And the third way is by giving appropriate medications. So when you give medications, unfortunately, बहुत सारे लोग बोलते हैं just calcium लिया तो osteoporosis treat होता है. Unfortunately, that is not the only treatment for osteoporosis. Calcium, vitamin D3 is definitely very essential for improving the bone bulk, but you have to improve the quality of bone also. And for that, there are special injections that have come in today's scenario, which can be utilized effectively for treating osteoporosis. So exercises are there. Each one, the exercises will be different. It may not be the same. What exercises that we would recommend you to avoid would be impact, especially if you've been diagnosed with osteoporosis, would be impact activities. If you've not yet been diagnosed with osteoporosis, then at least 5 days in a 1 week scenario, you should be exercising. And this should involve right from strength training, resistance exercises, as well as impact exercises. So what are the treatment options? The medications, as we discussed, there is one set of medicines that helps, which injections and medicines that helps in preventing further bone deterioration. जो हड्डी फॉर्म हो रहे हैं उसको लॉस होने से रोकने का काम जो इनहिबिटर्स करते हैं. एंड स्टिमुलेटर्स करके एक रोल रहते हैं जो हड्डी फॉर्म करने के लिए, हड्डी वापस बनने के लिए हेल्प करते हैं. उसके अलावा कैल्शियम, विटामिन डी भी है जो फ्रेमवर्क है उसके ऊपर डिपॉजिट करने के लिए. तो हाउ डू यू प्रिवेंट ऑस्टियोपोरोसिस? ऑस्टियोपोरोसिस इज नॉट समथिंग जो रात का रात चालू हो जाता है, राइट? इट इज समथिंग which happens because of lack of you not giving appropriate time for yourself. Now, when we are 30, 40, we are running around to earn money. When we reach 45, 50, we try to enjoy some part of what we have earned. When we end 55, 60, we are leading a very relaxed life. We feel, abhi itna kama liya, let's just relax. Unfortunately, we are not giving any time over there for exercise. And once that happens, what people go through is osteoporosis. So, for that reason, having a balanced diet is very important. Having greens, especially palak, methi, is very important. Having almonds is a very good source. Also, having milk twice daily is very good. From diet point of view, that is definitely essential. Exercise, exercise would involve, if you've not yet अभी तक osteoporosis हुआ नहीं है, तो at least 5 days a week exercise करना is very important. उसमें especially 3 days के लिए strength training, 2 days के लिए cardio, 1-2 days के लिए resistance exercises include करना is always very essential to keep your joints mobile. And what ways can you prevent it? Again, if you're smoking, you're a very high risk, not only for a chest related complications, but also for osteoporosis in the future. Alcohol consumption beyond a limit, especially taking it regularly, not exercising regularly is a risk factor. And as we discussed, calcium, vitamin, and nutrition. Especially, how would you screening, if you go through a screening program, अब female है, especially menopause हो चुका है, if you've reached 50 years, my suggestion would be आप एक बार bone density scan या DEXA scan करा के लीजिए आपका. If वो DEXA scan normal आया, तो then every 4 years में एक बार you have to repeat the DEXA scan. If वो DEXA scan normal नहीं है, आपको osteoporosis detect हुआ है, तो then please get treated for osteoporosis, meet your orthopedic doctor, get treated for osteoporosis, repeat the DEXA scan every 2 years until you are free from osteoporosis. If you are a male, you should get yourself tested once you reach 55, 60 years. So for a female, it's between 45 to 50 years, and for a male, 55 to 60 years. Please get yourselves a DEXA scan and get treated for osteoporosis. So in India, osteoporosis is a very common problem. In fact, right today, I have admitted a patient who just went to the bathroom yesterday night and sat on the chair commode. And she was unable to get up after sitting on the chair commode. Her age is 75. Relatives were very anxious. When we got her to the hospital and did an x-ray, she's developed an osteoporotic spine fracture. So it is that common in India. Just sitting on a chair commode caused an osteoporotic fracture. It often remains silent and you don't know until you develop a fracture. Awareness is very poor. किसको मालूम रहता है ऐसे बैठने से भी फ्रैक्चर हो सकता है? कौन ऐसे सोच सकता है? सो बैक पेन, कमर, लॉन्ग टर्म से आपको कोई आपका रिश्तेदार हो, कोई रिलेटिव हो जो आपको बोल रहा है कि नहीं मेरे को बहुत दिन से कमर दुख रहा है, सीधा बैठना नहीं हो रहा है, थोड़ा आगे झुकना बैठना पड़ रहा है, हाइट थोड़ा ऐसे झुक के कर रहे हैं. सो ऑल दिस शुड बी टेकन वेरी सीरियसली एंड वी शुड नॉट से हो जाएगा, थोड़ा गर्म पानी से शेक लेते हैं, थोड़ा मालिश कर लेते हैं, ऐसे बोल के उसको इग्नोर करना नहीं है. Exercise is definitely there to help in bone building and also for flexibility. And managing osteoporosis is definitely possible to help in preventing your future fractures. Thank you.
Thank you, Dr. Rao, for taking us through bone and joint health in elderly patients and parents.
Yes.
So we will now proceed with the question and answer sessions. We have received quite a few questions from our viewers.
Sure.
So the first question that we have received is, sir, at what age do bone health issues or disorders typically begin?
So the bone health issues typically begins for females. There is two, we'll have to categorize it. For males, it is a little different, and for females, it is a little different. For females, especially after menopause, around 45 to 50 years. And for males, it is especially called andropause at 55 to 60 years. So that is when they should start getting themselves tested with a DEXA scan.
Okay, sir. The second question that we have received is, how will I come to know if I have osteoporosis and when should I meet a specialist for the same?
Correct. So that's a good question. So unfortunately, osteoporosis is a silent killer. मतलब
Right.
आपको कभी ऐसे सिम्टम्स भी नहीं रहता है एंड यू फील मेरा शरीर को कुछ प्रॉब्लम नहीं है, मेरे को बीपी शुगर नहीं है, तो मेरा लाइफ में कुछ प्रॉब्लम नहीं है. No, unfortunately, osteoporosis ऐसा नहीं है. So, if you don't have any symptoms, even if you reach 45, 50, you should get yourself tested. You should do a DEXA scan, as we discussed, a dual energy X-ray absorptiometry. It's an X-ray scan. वो X-ray scan में, as we discussed, osteoporosis है, osteopenia है या हड्डी normal है. ऐसे 3 कैटेगरी को वो कैटेगराइज करेंगे. वो बॉडी का पूरा बोन्स को स्कैन करते हैं उसमें. सो कोई भी एक बोन में ऑस्टियोपोरोसिस है करके निकला, so you should visit a specialist who is versatile or who knows about all the medications that are used in osteoporosis for its treatment. Now we have very good medications in the market right now, which were not available few years ago. Considering we have denosumab, we have teriparatide. At that point of time, 2-3 years ago, we only had zoledronic acid. So now we have a variety, a buffet of treatment options which can be utilized to prevent further complications.
Right, sir. So our next question is in line with this suggestion of yours. The question says, apart from X-ray and DEXA, which other
Right.
tests are widely available to diagnose osteoporosis?
So we commonly use DEXA scan. Other than that, we also recommend doing a calcium and a serum vitamin D3 as well as a serum PTH levels. So all these will help us know how we can taper your medicines and suggest which medicine is appropriate for your treatment of osteoporosis.
Right. So serum calcium and serum PTH would be a blood test, right, sir?
Serum calcium, serum vitamin D3 and serum PTH would be blood tests.
Okay. The next question says that there is a very common belief in amongst Indians, sir, especially in the older age, in our parents and elderly, where they believe when we say them to take calcium on regular basis, and they say it is not required. इसका कोई requirement नहीं है, daily tablet खाने से side effect और होता है मुझे. So they usually deny to continue calcium therapy on long term. So how do we break this myth? Because as we know,
Right.
calcium is of utmost importance for all the elderly amongst available in the country,
Correct.
right?
करेक्ट. सो एज वी डिस्कस्ड, स्पेशली वो मेनोपॉज और एंड्रोपॉज के बाद ना एकदम वो ईस्ट्रोजन जब कम हो जाता है तो ऑटोमेटिकली आपका बॉडी का विटामिन D3 कम हो जाता है. एंड जब विटामिन D3 कम होता है, द रोल ऑफ विटामिन D3 इन द बॉडी इज टू एब्जॉर्ब कैल्शियम स्टमक से. सो विटामिन D3 कम हो जाता है, ऑटोमेटिकली कैल्शियम भी कम हो जाता है. सो कैल्शियम विटामिन D3 का कमी होने की वजह से योर बॉडी इज डेफिनेटली लैकिंग बियॉन्ड अ सर्टेन पॉइंट, स्पेशली इन बोथ मेल्स एंड फीमेल्स. फॉर दैट रीजन कैल्शियम एंड विटामिन D3 लेना डेफिनेटली जरूरी है. स्पेशली आपको व्हाट यू शुड डू इज, इफ यू डोंट बिलीव इट, एक बार विटामिन D3 खुद का चेक करके लेना चाहिए. इफ योर विटामिन D3 इज लेस, दैट मीन्स योर कैल्शियम एब्जॉर्प्शन भी कम हो रहा है वहां पर. सो वो ब्लड टेस्ट करके आपको मालूम पड़ जाएगा कि आपको कैल्शियम का रिक्वायरमेंट है या नहीं है. सो इफ योर विटामिन D3 इज लेस, देन अंटिल दैट गोज बैक टू नॉर्मल, आपको कैल्शियम विटामिन D3 लेना जरूरी है. If your vitamin D3 is normal, every 6 months you can repeat your serum vitamin D3 or every 1 year. And based on that, you can take a call on going ahead with your calcium and vitamin D3 intake.
Right. So calcium and vitamin D are of utmost importance,
It is of very
irrespective whether
utmost
you
importance.
have bone health issues or not, right? sir?
Correct. Yes.
Correct. So the next question is, what are the latest treatment options available for managing osteoporosis and other bone-related conditions, especially in elders, patients who are above 75, 80 years of age?
Correct. So the latest treatment options are that we have very good injections in the market right now for the treatment of osteoporosis. One category of injections, what they do is they prevent bone breakdown. Bone और हड्डी कमजोर होने से रोक देता है. The other injection helps in forming more bone. So these injections have been a revelation, especially in the treatment of osteoporosis. So these, and there are a lot of tablets also available in tablet format, also available, especially bisphosphonates, which also help again in bone breakdown, in preventing bone breakdown. So considering all this, we have a buffet or a portfolio of medicines available right now, which can help prevent further complications in osteoporosis, and which
Based
can help
on-
treating osteoporosis completely.
Okay, sir. So based on the score of the patient or the stage of the patient, therapy can be given, right?
Correct.
The next question is, bone and joint pain are very common, right? Back pain, joint pain. Usually, all our patients or all our elderly family members face it after 60 years of age. So
Right.
for them, what kind of exercises should we recommend that you can do it at your home?
Right. So in fact, I will tell you some exercise which you should avoid, and then
Okay.
we'll come to exercises that we can definitely recommend. So
Okay.
the exercises that you can avoid would be any high impact activities, especially if you're above 70, something like running, impact activities, running, jogging, skipping. So these are activities that can cause sudden bone fracture if you have osteoporosis and you don't know about it. However, there are activities which will help, and that involves one would be weight training exercises, especially using dumbbells. So that second form of exercises would be resistance exercises with therabands. So therabands ke sath exercise karna is also very good. And third, swimming and stationary cycling is also very good form of exercise for improving the bone health and also the heart function.
Okay. So we just discussed about the benefit of having calcium and vitamin D on regular basis. So
Right.
one of our viewer has asked, there are multiple calciums available in the market. So
Right.
which calcium is the right one, or which calcium should we opt for?
Correct. So there are multiple calciums available. One would be calcium carbonate. The other would be calcium citrate. Calcium orotate is also available. However, it all depends on your depends on your blood levels of calcium. It also depends on your what you're able to tolerate. One is very easily absorbable. The other is less absorbable. However, it does not cause gastric issues or constipation. So all that will be tailored as per what your body demands are or what your body tolerates. So that is very subjective. It would depend on your doctor and what your complaints are.
Okay. One of our viewer has asked, what should be done immediately after an elderly person experiences a fracture? Because
Right.
currently we don't know what is the line of therapy immediately before approaching to the hospital. At that point of time, what should be done to manage the fracture?
So the most common fractures, especially elderly में, what we see, either वो spine fracture हो सकता है, नहीं तो hip fracture हो सकता है, नहीं तो wrist fracture हो सकता है, ये तीनों fracture. If you have ऐसे कमर में दुखना चालू हुआ अचानक से one fine day, that means कमर में वहां पर fracture हुआ है. So what you can do is थोड़ा बर्फ से शेकना कर सकते हैं वहां पर. पेशेंट को इंस्टेड ऑफ उनको पकड़ के उठाने से बेटर है कि उनको वहां पर थोड़ा सुला के लिटा के आजू बाजू contact your doctor, get an portable x-ray done. We are in an era where we can get an x-ray done at home. So portable x-ray करा के and then based on that we can take a call on how we have to go ahead if it's a spine fracture. If it's a wrist fracture, what we can do is we have to get, if गिरने के बाद wrist जो है सूज गया and pain हो रहा है, तो what you can do is घर पे कोई लकड़ी है या काटी है तो वहां पर रख के उसको एक दुपट्टा से बांध देने का, so that उसमें ज्यादा मूवमेंट नहीं होता है. एंड उसके बाद थोड़ा बर्फ से सेकने का, एंड अगेन उसके बाद यू कैन डू द फर्दर ट्रीटमेंट लाइक डूइंग एन एक्सरे. इफ आपको हिप में इनकेस थोड़ा जर्क हो गया एंड यू फॉल डाउन एंड खुबे में पेन बोल रहे हैं, दैट मीन्स देयर इज अ हिप फ्रैक्चर. तो ऐसे स्थिति में हिप फ्रैक्चर जो है उसको हमें वर्सन नहीं करना है और खराब नहीं करना है. तो ऐसे क्या कर, तो फिर वो टाइम पे उनको थोड़ा बर्फ देना है सेकने के लिए, उनको वैसे लिटाना है वहां पर, या एक स्ट्रेचर में लेने के लिए कोशिश करना है, या बेड पे सुलाने के लिए बेडशीट डाल के बेड पे सुलाने के लिए कोशिश करना है, एंड थोड़ा एनाल्जेसिक्स मेडिकेशन देके यू हैव टू विजिट द नियर बाय हॉस्पिटल.
Okay. So, sir, as we discussed, falls are the most common reasons for any fracture in
Correct.
elderly. So, what preventive measures can they take to prevent fractures or prevent falls, and which can indirectly, prevent from
So
the fracture?
as a person who is routinely dealing with elderly fractures, I see very commonly hip fractures. So this is one of my favorite questions that I usually like to counsel all my patients' relatives. One, please don't let your parents go alone to the washroom at night. रात को वॉशरूम जाने के लिए अलग अकेला मत छोड़िए. Second, please make sure that there is always light switched on. At least एक छोटा light switched on आपका रूम में, उनका रूम में एंड बाथरूम में लाइट स्विच ऑन रहना चाहिए ही. थर्ड, एंटी स्लिप मैट्स लगाना बाथरूम के बाहर बाथरूम के अंदर, सो दैट वो उठने के टाइम पे, मोस्ट कॉमन फ्रैक्चर होता है जब उठने के टाइम पे बाथरूम में, सो वो टाइम पे गिरना नहीं चाहिए, इसलिए एक एंटी स्लिप मैट लगा के रखना. फोर्थ, स्पेशली एल्डरली पीपल फॉर 70-75 के बाद भी दे वांट टू रिमेन एक्टिव, तो वो जोश में थोड़ा हाइट चढ़ जाते हैं, एक छोटा लैडर वगैरह चढ़ते हैं ऊपर से कुछ उठाने के लिए, वो टाइम पे वो बैलेंस चला जाता है उनका एंड दे फॉल डाउन. सो डोंट लेट देम यू क्लाइंब अप अ लैडर और एनीथिंग. एक लकड़ी या काटी देके उसमें थोड़ा हैंडल करने के लिए बोलिए. सो दीज आर वेरी कॉमन mistakes that we do at home, not putting on the light, allowing them to go alone to the washroom at night and slipping in the washroom, और 3 letting them to climb heights. ये सब अवॉइड करेंगे तो फ्रैक्चर्स अवॉइड करने का चांसेस अच्छा है.
Okay, sir. The next question says that there is a patient of 63 years of age, a female, and she is saying that can I walk on regular basis? And if yes, then how many steps should I walk? And for how long should I walk?
Right. So what we recommend is, yes, walking is definitely important. As we discussed, walking, what it does is it creates impact. Once it creates impact on your bone, जब impact गिरता है तो हड्डी और मजबूत हो जाता है. So walking is definitely important to help in preventing osteoporosis. Second, how long do you walk? Recommendation is at least 20 to 30 minutes brisk walking daily for improving bone health and cardiac health. The number of steps, it ideally does not matter. Even if you walk 4,000 to 5,000 steps, it is fine.
Okay. So we earlier discussed about injections for bone health, right? So there is
Yes.
a question from a viewer which says that अगर मुझे डायबिटीज है तो क्या इंजेक्शंस में ले सकता हूँ? उससे कोई
Yes.
साइड इफेक्ट्स तो नहीं है?
नहीं, डायबिटीज का और ऑस्टियोपोरोसिस का कुछ कनेक्शन नहीं है. डायबिटीज, यस, डायबिटीज है तो ऑस्टियोपोरोसिस होने का चांसेस रहता है बिकॉज ऑफ डायबिटीज एंड डायबिटीज मेडिसिन. बट इन दोनों का ड्रग का कुछ इंटरेक्शन नहीं है. सो हम डेफिनेटली ऑस्टियोपोरोसिस का इंजेक्शन ले सकते हैं सेफली विदाउट एनी कॉम्प्लिकेशन.
Okay. Even so, when we talk about bone health, arthritis is one of the important segments in it. And
Right.
there is a question from the viewer which says that nowadays, of lately, replacements बहुत ज़्यादा बढ़ गए हैं and it is a good option for managing pain. So, what category of patients should actually go for replacement and what category of patients you feel can be managed through medicines?
Okay, so osteoporosis is different and pain replacement surgery for pain is different. These are two different components. We should not get confused over here. Osteoporosis, the surgery which is done, replacements for pain is for arthritis. It is not for osteoporosis. जब हड्डी हड्डी घिसता है तो दैट इज आर्थराइटिस, घुटने का घिसाव या खुबे का घिसाव या शोल्डर का घिसाव. तो उसके लिए हम रिप्लेसमेंट्स करते हैं. ऑस्टियोपोरोसिस हड्डी का कमजोरी रहता है, हड्डी का घिसाव नहीं रहता है. सो उसके लिए ऑस्टियोपोरोसिस के लिए हम इंजेक्शन देते हैं. सो ऑस्टियोपोरोसिस इंजेक्शन, घिसाव is medicine. Sorry, Gisav is replacement.
Okay, so replacement is for managing the
Arthritis.
osteoarthritis.
Yes.
And injections are
It's
for
for
osteoporosis.
osteoporosis.
But sir, there are injections available even for knee osteoarthritis management. So
Correct.
that is also for
So
all
that,
category of patients?
no, so again, so the injections that are available for knee arthritis is in grade 1 and grade 2 knee arthritis where the bone is not touching each other. So that is recommended in early arthritis to delay your degeneration, wear and tear that occurs in the knee. So again, that is a different form of injection for knee arthritis, but that is not an osteoporosis. Injections are different. So these are two different categories of injections.
Okay. So there is one last question from the viewer which says that I do have thyroid and obesity. So am I at a risk of having any bone health issues in near future?
Yes, thyroid and obesity have been shown to have a risk factor for osteoporosis, especially a heavy body weight is definitely a risk factor. I would definitely advise if you've reached 45, 50 years of age, please get yourself screened for with a DEXA scan.
Okay. So with this, we come to an end of all the question and answer sessions. So thank you so much, Dr. Rao, for guiding us through the importance of bone health in parents and elderly.
Sure.
Your insights have been actually valuable in understanding how better we can manage this and how further we can improve the bone health.
Right.
Thank you so much for taking out time from your busy schedule. And for all our viewers who are watching us live from Mumbai, so we would suggest for all your bone health issues, do visit Dr. Rao. He practices in Shalby, Ghatkopar, Mumbai. And that is from Monday to Saturday. You can take the appointments and do visit sir for all your problems of bone health. Thank you so much, sir. And thank you so much to all our viewers watching us live.
Thank you.